Ever bite into like an ice cream cone, get a little brain freeze going, and then bam, that tooth just starts throbbing.
Oh, yeah.
Yeah, toothaches are they're the worst. And you know, it's almost as bad as the toothache itself.
Let me guess. The mystery of what's causing it.
You got it. So today, we're doing a deep dive into those tooth terrors.
I like that. Tooth terrors.
Right. We're talking what causes them, how to find some relief, and this is the big one, how to avoid them in the first place.
The best cure is prevention, as they say.
Exactly. And, you know, we're going beyond the usual brush and floss advice. Our listeners sent in, get this, 11 home remedies for toothaches.
11. Some of them must have been pretty creative.
Oh, you have no idea. We're going to unpack those, some really interesting ones. But before we get to the home remedies, we got to understand what's actually happening when you get a toothache. And let me tell you, it's not always as simple as a cavity.
It's true. Most people, they hear toothache, they automatically think cavity, right?
Right, straight to the dentist's chair.
Yeah. But a toothache, it can be a bit more, well, sneaky.
Sneaky? What do you mean?
Well, it could be an impacted tooth, like those wisdom teeth that just love to cause trouble.
Oh, tell me about it.
Or even something like teeth grinding. You know, a lot of people do it in their sleep, don't even realize it. But all that clenching and grinding,
Yeah.
it can really do a number on your teeth.
Okay, so it's not just what's happening inside the tooth, it's also the forces around it.
You got it. And here's where it gets really wild. Sometimes a toothache isn't even really about your teeth at all.
Wait, hold on. How is that even possible?
Okay, so think about it. Your body, it's a network, right? And sometimes those pain signals, they get a little crossed. You could have an ear infection, maybe a sinus infection, even problems with your jaw. And all of a sudden, bam, you've got tooth pain.
Whoa, so it's like your teeth are sending out an SOS, even if they're not the problem.
Exactly. It's like your mouth is saying, hey, something's wrong here. Help me out.
That's a little unnerving, honestly. So you're saying even a seemingly minor toothache, we shouldn't just ignore it.
Exactly. Because, and this is important, an untreated infection in your tooth, it can spread.
Spread, like, to other parts of your body.
Exactly.
Wow, okay. Definitely don't want to mess around with that.
Definitely not. And that's actually a good segue into those home remedies you were talking about. Because
So with these home remedies, we're talking about, like, easing the pain while we figure out what's really going on, right?
absolutely, think of them as a temporary fix, you know, not a long-term solution.
Right, not ditching the dentist appointment.
Exactly. But they can be surprisingly effective, some of them, especially, well, some of the more unusual ones you came across.
Speaking of unusual, garlic. For a toothache, I gotta admit, my first thought was, ouch. But then I did some digging, and it turns out it's actually been used for medicinal purposes for ages.
That's right. Garlic, it's got this compound, allicin. It's a real powerhouse antibacterial, even antiviral.
So it's not just about warding off vampires, then.
Nope. It's fighting off those nasty microbes that could be causing the toothache in the first place.
Interesting. So are we talking, like, biting into a raw clove right on the sore spot?
Oh, no, no, no. I wouldn't recommend that. That's just asking for more pain.
Yeah, figures.
But crushing a clove into a paste and then, you know, gently applying it to the area, that could help.
Okay, that makes a lot more sense. Now, this next one, this one's straight out of an old Western movie. Clove oil. Didn't they use that for pulling teeth back in the day?
They did. Clove oil, it was a common anesthetic for a long time. And it makes sense, too. See, it's got this compound, eugenol, that acts as a natural pain reliever.
So it's kind of like a natural Novocaine.
Yeah.
That's pretty cool.
Yeah.
But are we really putting essential oils straight up on our gums? Is that safe?
Well, you got to be careful. Clove oil is potent stuff. A little goes a long way. Usually diluting it, putting a little on a cotton swab, that's the way to go. And even then, you don't want to leave it on for too long.
Too long, yeah.
It can irritate your gums. Could even cause, in some cases, like chemical burns if you overuse it. So yeah, temporary relief, use it sparingly, and definitely don't skip the dentist.
No DIY dentistry.
No.
Okay, ready for a curveball. One of our listeners suggested guava leaves.
Guava leaves.
Yeah, guava leaves. Apparently you can chew on them or make them into a tea for rinsing. Have you heard of this?
I have. It's a more traditional remedy, but yeah.
What's the deal with guava leaves? They have, like, magical pain-relieving properties or something.
Not magic, but there's definitely something there. Guava leaves, they've got these compounds that are both antibacterial and anti-inflammatory. Ah.
Okay, so they could help with the swelling and fight off infection,
Got it.
which, I mean, both of those things would definitely make a toothache way worse.
Exactly. It just shows that, you know, sometimes those traditional remedies, there's something to them.
Mother Nature knows her stuff. But we do have to remember, these natural remedies sound great for holding the pain off, but they're not going to replace a trip to the dentist, are they?
You hit the nail on the head. Always better to be safe than sorry, right?
Right. So how do we know when it's more than just a little toothache? When do we actually pick up the phone and call the dentist?
Good question. If that pain sticks around for more than a day or two, or if it's really bad and the over-the-counter stuff just isn't cutting it, that's your cue. Time to make that appointment.
Okay, what about other warning signs? Like, are there specific things that should make us think emergency dentist now? Besides the pain, obviously.
Absolutely. Fever, that's a big one. If you've got a toothache and you're running a fever, that could mean infection and that needs to be looked at right away. Swelling too, whether it's in your
Right.
gums, your face, even your jaw.
So that's a sign things are getting a bit more serious. What about, like, full-on go to the emergency room serious?
If you're having trouble breathing, difficulty swallowing, if the swelling is severe, or you start experiencing chest pain along with the toothache, those are all signs of a potentially very serious infection. In those cases, get immediate medical attention.
Wow, okay. I think there's that myth out there you can die from a toothache. And, well, that's not exactly true.
It's not totally a myth either. Like we were talking about earlier, if you've got an infection in your tooth and you let it go, it can actually spread to your bloodstream. And that can lead to some very serious complications.
Message received, don't mess around with tooth infections.
Yeah.
So, say we've managed to survive the toothache from hell. What's the best way to avoid a repeat performance? We talked about some DIY treatments, but what about prevention?
Well, the basics, brushing, flossing, regular dental checkups, gotta do those. But let's take it a step further. Brushing, for example, a lot of people don't realize there's a right way to do it.
Oh no, am I brushing wrong? I'm about to find out I've been brushing wrong my entire life, aren't I?
You'd be surprised. Using a soft bristle brush, gentle circular motions, those are key. And don't forget your tongue. Tongue scraping, that can make a huge difference in reducing bacteria.
Tongue scraping. Okay, that's a new one for me.
It's really simple. You just use a little tool, kind of like a scraper, gently remove the bacteria and build up from your tongue. Fresher breath, better oral health overall. And of course, diet plays a big role. Sugary drinks, snacks, those are bad news, we all know that. But acidic foods and drinks, those can be a problem too. They can wear down your enamel and make your teeth more vulnerable.
It's not just what we eat, it's how acidic it is too. So much to think about. This has been an incredible deep dive. I feel like I learned so much, from garlic to guava leaves to tongue scraping.
Right, you never know what you might learn.
Exactly. And speaking of learning, here's a little something for you to chew on. What does your current oral hygiene routine look like? And what one thing are you going to change after today? Head over to our social media, use the hashtag #toothachenomore, and let us know. And remember, a healthy smile starts with taking care of those pearly whites.